Hi, I'm Dr. Becky Coats with TMJ Plus. Many patients have wondered, what does the plus really mean? It just says TMJ. What I mean by that is when patients come to see me, the plus means helping them find solutions that's going on with their total health beyond just being a dentist who looks at teeth only and measures with your hands. So for example, patients that come in that have other health issues, such as, like you for instance, autoimmune, diabetes, chronic pain, inflammation, heart disease, always taking blood pressure medication, thyroid problems, sinus issues, reoccurring headaches. So all of those things are related to the mouth. So for instance, I made some notes. I want to make sure that I'm speaking directly to you and anything that might be going on with your family. So revealing the root cause, no pun intended. So when someone comes to my office, I would rather be the type of doctor that is treating you the holistic way, the plus. That might mean that I'm not going to be the first person that you see to make progress on what needs to be done. I might come later on in the chain of your care, and I'm okay with that because my interest is to find and help you in ways that you're searching for, how it should be in medicine, your experience. Let's just say that you have any of these things going on the top of the tree: blood pressure, autoimmune, infertility, weight issues, GI problems, breast issues, headaches. How is that all tied into the why? I think that here's the bottom part here of what caused all that. Well, there might be a bacterial problem, yeast, viral, dental infection, metal toxicity in your body, maybe in the type of fillings or crowns that you have in your mouth. Old root canals, subclinical infections that are there, but someone else hasn't pointed out to you yet. So I've decided to help patients and go deeper by looking at thermography. Thermography is a diagnostic tool that's different than an MRI or blood work that typically you've probably already had done, and you've probably gone to many other practitioners and been searching for, well, this person doesn't have an answer, and that test was inconclusive, and I still have my thing. I don't know if that ever hits home for you. I hear that many times. So why the TMJ part, people come to see me for that, is the holistic part too. Someone who can help point you in the right direction. So thermography is a tool. It is FDA accepted. It is basically measuring temperature points in your body. And so a slide on this is that it's measuring around your face, your teeth, your abdomen, your neck. It's measuring points of where you can have focal problems. So it is a way to help diagnose issues or problem solve that you haven't seen before. Why do I do that? Because I want to know exactly what's going on toxicity-wise in the teeth. You may know a little bit about teeth and how they are connected to different body parts and organs. The measurement points is just a graphic of what you're going to have tested at the thermography center, and maybe a sample of what your report would look like. Basically, different zones of focus. Some that are going to be colorized, and as you had a thermography report, that would be explained to you and understand the meaning of how that's tied into the pain or diseases that you have. Also, a report would be how that's tied into teeth. So there would be a representation of your teeth and ones of focus or hot spots. And in that report, it would tie into which organs and how that's correlated. So my part is looking at a thermography report and tying into what's going on with your health, what your complaints are, as well as looking at a CBCT x-ray, which is looking at your sinuses, your spine, your TMJ, your teeth in a 3D dimension, and merging that data to best help patients. Gums disease is something that might show up, whether you think you have it or not. It's something that we see that comes up. bacteria in the mouth, yeast. And it may be something that you're just not aware of. It hasn't been detected, or you haven't had a proper periodontal screening or a saliva test to figure out how that's connected to. Look at all these major players. Most people have some myriad of things here. Inflammation, arthritis, bone disease, ulcer, GI issues, hypertension. The list goes on. That's how in a dental setting we can help pinpoint which teeth, not just gums, but in the bone, it's affecting your health. Here's a slide. Half of America has some form of gum disease. Shocking? I can tell you I've seen that over my 18 years of practice. There's ways that we measure beyond your gums of how to track that, how to help you. I want to share with you a case study of how this was important to merge unresolved health issues, thermography that pointed us in the right direction of our patient John, and what presented in his mouth, and how we merged all that together to point him in the right direction for relief and solutions. We had a tooth that was infected more than once, and I've been seeing this patient for several years, and there were other things health-wise that was not okay. Even though working out, we all think that we run and that makes us healthy, but there are things such as lymph drainage. You know, if you can't process and get rid of toxins in your body, they will build up. So you will have issues with your blood pressure. You'll have GI issues. Your glands will be swollen. You'll have inflammation. You will have dental issues, reoccurring pain, and or headaches. There's the infection. Guess what showed up on the thermography report? That there were bone issues within the teeth. It gave us a representation how to help this patient. One of the ways was to get rid of the unresolved lymph issues. And that has to happen first before I can do my part and help you with your teeth. I'm not always going to be the first person that you see, and I'm okay with that because it's more important to figure out the why. So what you do with your health and spend your time and money on is going to be affected. Here's merging the CBCT data, which also went with the thermography report, so we could really communicate to you what's going on by individual teeth. This is probably an x-ray that you've seen before, like a panoramic. The technology that I do is so much different. You're looking at a cross-section of your head. You're looking in each individual teeth to look for areas that are not healing, or what's called bone cavitations. Why does someone keep having sinus issues or acid reflux or the toxicity? Another thing, if you get referred to an ENT and you have a sinus infection and they tell you to do maybe rinses or nasal sprays, here's the major take home. You have a lymphatic issue. That lymphatic issue is causing your dental problems, which is likely spilled over to autoimmune, diabetes, all of the many health effects that you might have. And it's a reoccurring issue of sinus infection. So it's kind of like saying this: if you don't get the toxins out of your body and lymph, you're going to keep having problems. And that's where the TMJ Plus comes into play, how I'm different. Looking at thermography report with you, identifying different solutions to help your health, connecting you with professionals that can help with blood pressure, virus issues, sinus blockage. My part is the dental toxicity, getting the metals out of your system, blocked lymph glands. I'm Dr. Becky Coats, and what is the plus? The plus is how I can help not just your teeth, but your total health. I look forward to meeting you soon.